Each month on Smart Medicine, we give you the chance to ask the expert. This month, menopause and hormone replacement therapy. Joining me now is OBGYN Dr. Margaret Summit. Thanks so much for joining us, Dr. Summit.
Oh, you're very welcome.
Tell me what menopause is.
Okay, the definition of menopause is when the ovary completely stops producing estrogen. And then what happens after that is that the ovary is no longer capable of maturing eggs, which then leads to ovulation, which leads to a menstrual cycle. So menopause is stopping of the menstrual cycle and ovulation. The most common symptom is that you do start to skip and then eventually will stop your period. The definition of being postmenopausal is where you have not had a menstrual cycle for 12 months. And there is another term that may be confusing, is something called perimenopausal. And perimenopausal is the time that surrounds menopause. It could either be before or after. And this is actually the time span where people do experience the symptoms of menopause. Prior to the total stopping of estrogen production, women will skip their cycles, and they may also have the next common symptom, which is called the hot flash or hot flushing. This is actually a physiologic response to the waning of estrogen production.
Tell me about hormone replacement therapy.
Hormone replacement therapy is replacement of estrogen that the ovary has stopped making.
It's been a bit controversial.
Yes, according to the Women's Health Initiative study, there are risks involved with taking hormone replacement therapy. Essentially, you are at increased risk for developing a blood clot when you use any kind of estrogen, and that does include birth control pills. And the blood clots that we're concerned about are blood clots that could lead to a heart attack, a stroke, or it could lead to a blood clot that lodges itself in the lung called a pulmonary embolus.
That's the risk, but the benefit to HRT would be a cessation of hot flashes.
Correct. In most women, there are some women who do take hormone replacement therapy who their hot flashes do not go away. And we have to wonder sometimes, are their hot flashes truly only associated with the waning of estrogen production, or could there be another cause?
Dr. Summit, thanks so much for joining us.